So we are slightly changing the agenda up slightly. So Pip is going to go first before we go into the current position and the recap.
Brilliant. Yeah, do you want me to, shall I just kind of make a start on the bit about Leeds Community Healthcare?
Yes, please. Yeah. The third sector strategy.
Oh, brilliant. I will do. Yeah, huge welcome to everyone. I don't know if it's anybody's first meeting, but yeah, really great to see people here at the Communities of Interest Network, which is a fortnightly Zoom and just gives people a chance to come and share what's happening, hear about what's happening, and kind of have that real live connection with all of the work that's happening in some of the sort of diverse and different communities of interest across the city. So yeah, Stacey's chairing, and I'm sorry, I can only stay for the beginning bit today. So Stacey very kindly suggested that I just go first. So I just wanted to just tell you a little bit about some of the long-term work that we're doing with Leeds Community Healthcare and third sector strategy. So this meeting is very often about, very live and current things that are happening last week, this week, next week. But it's really important that working with other partners, Voluntary Action Leeds and third sector Leeds and all of the different third sector and other partnerships actually with other sectors across the city, that we're trying to really make sure that we're doing the long-term change and making sure that things are more inclusive and different voices are heard, and that we're working together to always constantly try and learn and improve and make sure that the system's as good as it can be. So with that in mind, we just wanted to flag with you some of the conversations that we've been having specifically with Leeds Community Healthcare, and also we're starting to have with the Teaching Hospital Trust as well. So big NHS organisations, obviously Leeds is incredibly lucky in lots of ways, isn't it, that we've got really good and strong local NHS organisations that connect in with us in the third sector and with other partners. And one of the things that we've been trying to do over the last couple of years is make sure that we've got a clear voice, and that the conversations that the third sector is having and that the impact that the third sector is making is really recognised and seen as very valued as part of that kind of wider system. So one of those, as an example of one of those specific things, we've been talking to Leeds Community Healthcare. So does everybody know Leeds Community Healthcare? They provide adult and children's services right across the city, all sorts of things from kind of sexual health and homelessness, continence, right through to speech and language therapy and district nursing, huge range. Obviously musculoskeletal, so things like physiotherapy and occupational therapy, various, a whole range of different kind of health interventions and support, working alongside very much primary care, but also the third sector, obviously, and, inter-secondary partners as well. So as part of all of that, there's a specific piece of work that we've been doing to think about what the priorities should be for work with the third sector. And I'm just going to put on the chat, there's basically a bit of a menu of potential priorities that Rachel Cooper has been leading this work with Leeds Community Healthcare. So there's a specific ask today to just have a think about this, not to put people on the spot now, but if people want to kind of take away, we could have a conversation about it, but I'm conscious how much else there is to discuss. But some of the kind of priorities that you might want us to be having conversations with Leeds Community Healthcare specifically about. There's a bigger document which we'll share electronically, which has got some examples of what these kind of things might look like. So for example, under integrated working, that might include increasing things that we do in partnership between third sector organisations and the community healthcare. There's the second one's about utilising the health inequalities expertise that you all have, and one of the specific examples might be about more training from people in the third sector to NHS staff, for example. So quite practical things, really. this is obviously part of bigger conversations that we're having across the whole system to make sure that there's a wider third sector strategy that takes on board all the challenges around third sector resilience and making sure we're more stable and, you know, more securely funded and recognised. But real opportunity to just think about some of the practical stuff actually that could really make a difference. So just wanted to flag that conversation with people, to welcome people to link in directly with Rachel Cooper, with myself at Forum Central, you know, or through, you know, other networks, you know, other people that you've got, to perhaps share the document that we can send out afterwards to other organisations. Really conscious, we ask a lot of you, and I know we send you a huge amount of information. So, you know, if this just feels a thing too far, that's absolutely fine as well. But I think it's about where there are opportunities to really shift the longer term landscape. That's kind of important too, isn't it? So be assured that we're on this anyway. We will be taking the conversations that we hear from you all of the time into these discussions. And there's a bit of a subgroup around this work, but just putting that opportunity out there because we know how close you are to the stuff that really matters to people.
Thank you, Pip. And just in case anyone didn't get the link that we shared last week, I've just bobbed it in the chat, and it opens the document up, which lists all the objectives, and just for you to just have a think about and feedback in for that. Just to kind of give you a bit of what the picture looks like in Leeds in terms of the numbers. So the overall infection rate for the city is now at 162 per 100,000, and that's roughly about a 16% decline over the last 7 days. I think it is stable in terms of that, and the over 60s rate is now 115 per 100,000, so that's looking good. I was going to give a bit of a update on this CEV, just from some meetings that we've been in with Rachel. Shall I just give a couple of bullet points, Rachel, and then if you want to just expand on something, I think we've got an extra few minutes for that. So for those of you that might not be aware, clinically extremely vulnerable, now that's been extended until the 31st of March. What that looks like in Leeds is that just over 11,000 people will be added to that CEV list in Leeds, and the letters have started going out already, and unfortunately they're just only available in English. Rachel Loftus has been running some sessions over the last few days to give people more information around why people have been added to that list, and what the makeup of it is, what conditions potentially could be contributing to that. So do you want to just expand on that a little bit, Rachel?
Yeah, if that's all right. So I think there's a few things that would be really helpful and useful to get the insight from this group in, and your help in making sure we're spreading the word. So as Stacey said there, there's a new way of identifying people who've got the equivalent risk to those who've already been identified as clinically extremely vulnerable. So kind of the way we've been saying is like there's 3 ways now to get on the list. One is that you have one of the conditions that would make you really clinically extremely vulnerable. That's something like having had a recent transplant or a solid organ transplant ever. The second way would be if your GP had said you've got a combination of conditions. But this third way of identifying people is to look at factors where your condition, your medication, and things about your overall health interact. So for example, if you've got mild asthma, that wouldn't currently put you on the list. But if you've got mild asthma and a BMI of 39, and you've got another condition that also doesn't have you on the list, and you live in an area of relative poverty, the chances are your combined score will now have increased compared to somebody, you know, a child with childhood asthma will not score the same way. So what's really good about this is that it's really when input correctly, it's a really rigorous way. And what they've said is that if they could have done this at the beginning, then they would have predicted about 90% of the people who became seriously ill or died from COVID-19. So that's brilliant. The downside of it is the only way of doing it really, really quickly is to have just done it based on patient data. So basically what's written on a patient's record already and what's checkable from a national source. And again, I don't think I'm giving you new information here, but patient data isn't always accurate. And that's everything from some people haven't got their BMI on their record, for example. So if you haven't had a health check at the age of 40, anyone under the age of 40, unless they've had other reasons to have their BMI checked, it won't be on there. Ethnicity and your conditions is a way that they can see an increased score. So for example, the example I was given was if you are African Caribbean with chronic kidney disease stage 4, you will likely have worse outcomes than a white British person with the same stage 4, because they know, again, kind of looking at data in terms of how that impacts. So those combinations of factors is what's going to identify your risk. But for many people, they will have been sent a letter last week, and they won't necessarily know why, and they'll want to know why, and for some of them it will be because there is something inaccurate on their record. So we know, for example, one thing that keeps getting flagged up in the last few days is people who've had gestational diabetes. So if you've had gestational diabetes, the chances are it might be on your data as though you've got diabetes, but it literally only lasted during pregnancy, and you might have been pregnant 10 years ago, but it's still coming up as that being listed, and it combined with other factors might mean you've been identified. So we do know that for lots of reasons, that this means that there's going to be a lot of people confused, want to know answers, but we don't have 11,000 clinical appointments available in Leeds this week. We just don't have that, that ability to go in and check for each individual patient. So what we've said is, in the first instance, because we've planned to have this number of vaccinations, if you're offered a vaccination, please do take up the offer. Don't feel guilty. Don't feel like you're taking somebody else's slot. If you don't know why you've been offered it, please do just take it, because actually it's much more time and cost effective for everyone if you get vaccinated now and we sort the data issue as time goes on. So that's one thing that we can really help getting the message out to people with. The second one is obviously the advice coupled to the offer of vaccination is to follow shielding advice. Now, for a lot of people, again, that's a big undertaking, certainly for the next 6 weeks, to follow shielding advice. Some people will not be prepared for that. So obviously there's a lot of people who they've gotten good at shielding now, they've sorted themselves out, that they know what they're doing. Whereas to suddenly get invitation, like I know somebody, we sent out some text this morning because we were told that all of the letters had been sent and received now. But somebody, just literally text straight back and said, I'm on my way to work, what should I do? And so it's that level of kind of intrusion and unanticipated kind of difference. So again, what we're saying to people is, this is because you've been identified as being at risk of being more vulnerable, of having more serious illness. It's up to you what you do with this information. So for the next 6 weeks, the government is providing support with employment. Local organisations and groups will help you to stay at home if that's what you choose to do. And this is a way of just helping you to make a decision. You're not being forced to shield. It's not, it's not a legal requirement. All of that kind of stuff is really, we hope, will help get people in that mindset that this is, kind of a good way of knowing that you might be one of the people that be at risk. The other issue, obviously, is that we've got a lot of people saying, well, should I have been identified before? Why was I not? Have I been, neglected? And I think the only thing we can say to that is, this is, you're one of the people, that we couldn't have predicted a year ago, but we can predict now. So we've done everything we can to try and find you know, this group of people as soon as possible. And this was the first time that we were able to do it, and it's been done in this really fast way to do that. I think then we've also got people who are kind of saying, well, I've survived until now, what, you know, it's not going to get me. And I think for those, you know, I would give the same advice that I've been giving to everyone, which is kind of every day is an opportunity not to catch this virus. You know, every single day is a day when you can change your behavior you know, and take different actions that may help you to not get this virus and therefore not become very sick with it. So those are the kind of key messages that we're trying to get out at the moment, knowing that there's a lot of noise and a lot of confusion in the system. So those 11,000 at the moment that have been added, they're all under the age of 70. The vast majority of them, so 50% of them, just over, live in IMD decile 1, so areas where poverty and exclusion is more likely. And we also know that's also where it's more difficult to work from home. We know, you know, there's almost a, you know, an absolute diagonal line between the ability to work from home and the area of multiple deprivation that you live in. So we know that these factors are going to be more likely. So with that in mind, again, kind of supporting people to know that their employment, you know, is protected by the shielding letter. If they've got a shielding letter, you know, their employers cannot, you know, kind of sack them or any of those kinds of things. If they are going to take a significant hit in terms of their income, we've got some flexible support grants available now. So it's, you know, if somebody says I can't afford to take furlough because in my office it means this much, or I can't afford to take sick pay, these are options that we've got to support them if they want to make that decision. So again, it's all in the latest routes to support, and it's all in there. Similarly, if people have got really practical concerns like you know, caring for others, or, you know, even just taking children to school, all of those things, you know, please do encourage them to call the helpline, and we'll see what we can do to kind of create the support around the person, not, you know, not have support and they can come and take it or leave it, which sometimes it feels a bit like when the government does that communication, there's a bit of that, this is what you can have, whereas actually in Leeds we've got a much more person-centered approach, much more holistic view around what will help people. So that's the big thing. The other thing that I'd really like to get your take on and any ideas or views from you is that the way the new identification system works, people with learning disabilities, people with serious mental illness are more likely to be identified using this algorithm. It's not necessarily because of their pre-existing health conditions, but it's generally their ability to recover from COVID once they catch it. So it's a slight, this is what's good about the sophisticated algorithm, is it takes into consideration those people who once they've caught COVID have not been able to recover as well. And that's either because of their medication or because of their mental health, where things like oxygen and other things become difficult for them to have. So that group of people, like I say, the letters have gone out only in English. We do now actually have the translations, I've been sent them, of the letters, but obviously as ever we can have a translation of a letter, but we don't know who needs what translation. So again, any of you looking for translations of things, there's links to it now in the new routes to support document. So again, please do that. And the easy read version this time I think is really good. Or it might be just that I'm just lowering my standards every time, I don't know. I think it's really good this time for the first time. So I think, again, I've been using the easy read ones to get out to people wherever possible. The other factor obviously being that minority ethnicities are more likely to show up in using the new algorithm. We're getting the data on that done at the moment this week, but again, even that doesn't tell us more than an increased likelihood that people will speak another language. It's not, you know, it's not a perfect proxy by whatsoever. So again, it's any ideas that you guys have got about making sure that we are reaching out to people with learning disabilities, people with serious mental illness, and those who speak another language, in terms of making sure that they've got those key messages that if you've received a letter like this is what it does mean, this is what it doesn't mean, and this is the support that's available. Have I covered everything, Stacey?
You did a fab job in such a short space of time there, Rachel, but yes, yeah, sounded great. And just I mean, we do share the routes to support and the CV updates on the weekly update, but equally, if anyone can't find them or they want any more information, if they get in touch, and we can signpost them to the right links for the easy read information and anything new that Rachel and her team develop. So thank you, Rachel. Yeah, so at the last meeting, we talked about the information that you tell us, the kind of word on the street, and we talked about where we feed that into public health meetings, into the wider strategic meetings. And I just wanted to just share again just sort of how we capture. I'll just share it quickly. I did share it last time, but it's just around all the communities of interest that you can see on the left hand side, and throughout since when the communities of interest first started. This is actually a little bit out of date, so don't take that information. If you can see across the top, these are the issues that you as link organisations and voice of your communities have been telling us, and that's where we've been recording it. Then we can track over you know, what the trend is, if that makes sense, and we've just been adding to that each month and after each meeting. So it's just a quick and easy way for people to be able to look and say, right, we can see, is this an issue within that community, and how they then can react to what's being said. So off the back of that, if we can go into each organisation, think about you know, feeding back what the word is on the street, what you're hearing within your communities, what the barriers are, but equally what's working well. You know, it's not just about all doom and gloom. We'd like to know what's working well as well. So I'm just going to pick people at random if that's okay. Jay, is it all right if you go first? If you feedback what's happening within the faith?
Yeah, sure. Not much is happening at the moment, other than basically lots of work is being done with BME, not BME communities in terms of uptake of vaccines in a faith context. And similarly, also a lot of work is being done in the Muslim bit of the religions in Leeds for the uptake of the vaccine, because of, you know, connotations, etc. And so a lot of work is being done in that area. Other than that, not much else to tell you really, except I will get to send you at some point soon, I have been promised, the faith covenant document between the council and the faith communities of Leeds. It's almost there, but yay, the council's had other things on its plate to deal with.
Yes.
As soon as I have it, everybody else will get it, I promise.
Yeah, that would be great. Yeah, and just whenever you can get that through, we'll share it. So that's great. Selena, are you all right to go next?
Yeah, sorry, my name's actually Charlotte. It's my colleague is Selena. So we've been working really closely with the community, the Gypsy and Traveller community. So I'm from Leeds Gate, if anybody doesn't know. Leeds Gypsy and Traveller Exchange. We've been working really closely with the community, listening to what the concerns are. And we have been working with rural media. We've gathered over 100 Gypsy and Traveller members to take part in a survey that answers that gives them a chance to answer some questions around what the concerns are. Are they going to get the vaccine? Is there any questions they want answering? So as a team, we've all been working on that the last couple of weeks to try and get a really good overview of what the concerns are of members. We've also been getting a lot of feedback in welfare calls that we carry out weekly that have been ongoing through the full pandemic. So that's been the topic over the last couple of weeks, is to just get an overview of what people are feeling and thinking about the vaccine, just so we can get a general feel for what the best approach would be. Obviously to inform members on some information, some clear information around the facts of the vaccine, because obviously we want them to have a good support and a good like a good piece of information to be able to make the right choices to get the vaccine or not. We have been getting a lot of concerns around side effects, a lot of concerns around people thinking that the vaccine has got some sort of human feces in it, varied things we've heard over the past couple of weeks. But I think as time's gone on, and the more, the longer the vaccine's been around, I do think people are sort of warming a little bit more to it. Generally, that's a feel that we've been getting, even on social media. We've got a lot of members on there and who regular post things about worries or concerns around the vaccine, and we've seen a lot more people open now to getting the vaccine, or to elderly within their family getting the vaccine. I think it's just a bit about, it's new, isn't it? Anything new and unknown, people are gonna be wary of. So I think in time itself, it's gonna get, people are gonna sort of warm to it a little bit more. I don't know if that's the right word to use, but with the feedback from the surveys, we're working with Rural Media to make an animated video. That's going to be working with health professionals who are familiar within the community, that the community already recognise, and we know that they already trust, to answer some questions that have come out of the surveys. So we're going to pick a few main questions to really focus on. And within the video, we're going to be using some members' voices, so members will recognise the voices. So and we're open to do it in a really clear way that members are really going to sort of listen to and not find it too overwhelming, but at the same time, really making it really informal. And bearing in mind, we really don't want to make it leading, because we just want to be giving the information to people to make sure that they're empowered to make the right choice. So that's something that we've always had in mind throughout, is not to be leading. We're not trying to push people towards getting the vaccine. We're more trying to give them the right, accurate information to be able to empower them to make, a sensible choice. So yeah, it's been going quite well, and I'm quite optimistic about it.
Yeah, it sounds brilliant to engage and kind of get that response from that amount of people as well. That's amazing work.
Yeah. So keep you updated.
Yeah, please do. And just I'm sure most people are aware about the NHS CCG Leeds webpage, where there's lots of resources around the vaccine, some messages that might have already been developed and created. We can share links in a way with that, but yeah, that's probably a one-stop shop to go to make sure that it is those kind of right messages that's been given out. Thank you, Selena.
Charlotte, sorry.
It's difficult when you've got someone's name in front of you. Chris Bridle, are you all right to go next?
Yeah, I am. Hi, everybody. I'm really more here to sort of listen than I am to talk. I guess I would just reiterate what you've just said about on our webpage. I'll put a link in the chat. There's all the sort of latest resources around the COVID vaccine and just generally COVID. what we don't want to do, we want to make sure that people are going to the right place. So all the stuff on there is a trusted resource, trusted information. There's lots of information in different languages. If there's anything that you think's missing, so Charlotte, if you could share that video when it's done, that would be great. We can upload that onto the webpage as well, so we can make that, you know, available to everybody. So if there's anything missing on there, please let me know. But I'm here really to listen to you guys. Thank you.
Thanks, Chris. Janet, turning lives around. Are you all right to go next? Welcome. I think it's first time I've met you, Janet.
Hello, it's very nice to see you. It's usually Jen that attends. In relation to the vaccine and the vaccination, it's first of all, my organisation deals with support and accommodation for people who are rough sleeping and homeless. So that's the reason for our being. And as you can imagine, in these times, it's been very, very difficult because we have 3 intensive support environments and keeping a kind of to the rules and regulations have been very, very difficult amongst our client group. But if I just finish off on, and I've forgotten your name again. It's I can see the Selena, but I've forgotten.
Charlotte, sorry.
I said in relation to the vaccination, it's been really interesting because there's been 2 layers of our work really, and the first, for me, critical layer has been about our staff taking up the offer of the vaccine. We fought like mad to get recognised and on that front line basis. And then I thought take-up would sort of everybody be queuing up and getting there. But it wasn't the case. And even in some instances, our staff have been very slow and have had to look at further information about what's included in the vaccine. Is it safe? Is it experimental? Even to the case of I have rung round and not formally made an appointment with somebody, but just rung round for anybody that's on duty and said, hey, how are you doing and what's life like? And are you taking that? Are you having the vaccine? And some have said, oh yes, I'm there, but quite a percentage said, no, not yet. I'm going to wait and see. I don't like some of the stuff that's on Facebook, blah blah blah. So it's been a case of re-educating. Now we're over that hurdle, and of course, all our staff now are concentrating on our clients and how we actually educate. And like you said, we're not forcing anybody. We wouldn't want to do that. But how we give the right environment for them to make the right choices. So that's been quite a challenge. But that again is actually going on a pace now. In relation to a little bit of how this has all been affecting our client group, I can say that, for instance, we have a big proportion, a big service for young people, and they are being reported as more anxious, for feeling much more lonely, and feeling excluded, particularly digitally excluded. They're not at college, so they're feeling isolated, and some of them are losing out in relation to looking at offers for housing and benefits, and the the general feeling that was reported was they are feeling on the outside of everything. So that was from young people. In relation to a scheme that we have for women, women who work the streets, they are getting a feeling of loneliness, being more isolated, and they are finding it very difficult because of that to stick to any of the guidelines and the rules. So they're going out. It's difficult to maintain that they stay in and safe, but they're going out and filling that kind of space. And alongside that, in another sector that's actually, it's been quite apparent and overt that the women, and this is for women who it's an emergency accommodation, and it's for women that go immediately. And one of the things is they haven't taken to moving from the hotels, from the 3 meals a day and that kind of service, to going into the hostel as best they could. But one of the things that is brought up, which I hadn't thought about, being in this COVID environment, is it's brought up for a lot of women, their links that have stopped, and it's been fine with family and often with children. And this environment has pulled out a kind of crisis of, you know, I haven't seen this child for 10 years, or I haven't seen my mother for a number of years. And so there's been a kind of focus on, oh my goodness me, you know, people, they're hearing about people dying of COVID, that kind of thing, and thinking about their situation and their loneliness and their separation. It's come up psychologically more than, well, I mean, I haven't even thought about it. And also,
yeah, I think it's the first time I've heard that,
I just
Janet.
haven't thought about it at all. As a, you know, a pressure, a consequence, whatever you like to call it. And then not...
Janet, sorry, I'm just a little bit conscious of time, and we just...
I've rabbited on and could go on forever. And just one thing is, generally, drug taking has increased across all sectors.
Right, that's real cause for concern. Well, thank you so much, and lovely to meet you. Emily, are you all right to go next?
Yeah, that's fine. I've just got a couple of points to make this time round. The first one is about the vaccine in relation to women in maternity. So there's been a bit of kind of a bit of talk about it being a specific concern, and I know, because I've spoken to Shaq, that there's some specific materials that address that are already available. So I've contacted the MPV, the Maternity Voices Partnership, and together with them and possibly Sally Goodwin Mills from the breastfeeding work, we're going to put together those messages that are already there and put out a specific kind of blog post and some information in our newsletter. So not creating anything new, the stuff's already there, but to kind of get it out through our channels, and hopefully that will help. So that's the first thing. The second thing I wanted to talk about was the anxiety, and this isn't just for women, which is my community of interest, but this is wider, is the anxiety around coming out of lockdown. And we've got this brand new situation where we've been given this roadmap, and this is a massive problem for a lot of people. For women especially, some thoughts around employability and mental health and well-being, of course, as always, going through that process. But that's a new thing that I think I've been hearing quite a lot of in the last week, especially today, because obviously the announcement was yesterday, and one that I think needs kind of careful consideration, because I don't think necessarily people are going to be expecting those new feelings coming up, and how we manage those. So I think that's an important focus area going forward. And that's it for me.
Thanks, Emily. Yeah, sorry, I can't write quick enough. Capturing now.
I was just trying to be quick.
I know you were just a touch too quick then, and I think I'm running out of paper as well. So, but yeah, thank you. And I think we vaguely saw something around those concerns about coming out of lockdown, you know, after the second lockdown. But I think those concerns were slightly different. I think because of everything that's happening, those concerns are probably worse. And you know,
I agree. And for me, I think having those set of dates 5 weeks apart, it's quite rapid, really, which is great for some people. And you know, I'm not taking away from that, but it's basically they've done it in 5 week blocks so that they can see and get the data from 4 weeks, and then there'll be 1 week's worth of preparation for the next date that's coming out. Now that's quite fast. It's also quite stressful for certain people in certain industries to be able to prepare and work like that. So there's lots of different factors, but I think it's because this time is different because of that really clear set of 5 week block dates, which will just run quite quickly. And it does seem to be pitched as the final way out. And in a lot of ways, I think people aren't ready for that. Yeah.
And possibly it's a roadmap that might be snatched away at any point, depending on, yeah. Thank you so much. Caris. Hello.
Hi, okay. The focus for us has still been really around communication and sharing of information, and we've got involved in some different routes for doing that over the last couple of weeks, which has been really good and really interesting. And we've had a lot of focus around the interpreting support for Elland Road over the last few weeks as well. We're just waiting for a bit of an update around that as to what's going to happen moving forward, because we haven't seen a massive uptake initially. So we're in this kind of bit of a sort of chicken and egg where we've been kind of quite actively promoting the fact that that option is available for people, and then it's not necessarily being taken up initially. So whether that will continue or change, I'm not sure, but I'll certainly update next time on that. So yeah, that coupled with sort of some other engagements really, and sort of really just getting people involved. And what we're seeing is more of an uptake online now. So we've got a couple of our groups more established online, which is good. And hopefully start planning in line with some of the announcements yesterday, perhaps how we can start integrating in the next couple of weeks, moving back into our centre again. And so lots of things to think about. And it's been definitely a busy couple of weeks. So short and sweet from us. I hope I didn't freeze too many times.
No, yeah, I think you did it a couple of times, but it didn't affect what your message were. Thanks, Caris. Wendy, are you there?
I am, yes.
Hello.
Hi. So I'm kind of representing AIM at the minute as I was doing a training session. So they've still had a high use of the COVID toolkit and the peer support. I suppose I just want to raise again about the, autistic people aren't the same as people with learning disabilities. There's nearly 8,000 autistic people. The majority of them don't have learning disabilities. So your list of people with learning disabilities and autism experience this will be different for the autistic group that don't have a learning disability. So just point that out again. But similar to the people with mild learning disabilities, they may well not be registered with the GP, so won't have got those shielding letters. So that's an issue for some people. we're starting work in April with one of the local care partnerships, and we're also starting an LGBT project that was going to run for 3 years in April for LGBT people that are autistic or have a learning disability. So we'll still be in an element of lockdown, and we'll be sharing some of those resources with them, keeping it short. Okay, thanks.
Thanks, Wendy. Some exciting projects you've got coming up then.
Yeah, we've got a few more as well.
Jagdeep, are you all right to go next?
Of course I am. Hello, everyone. It's lovely to see so many faces.
Where are you from again, Jag? Sorry.
Leeds Involving People.
That's it.
Hi, everyone. We've got a lot of work going on with the adult social care directorates around how do we increase uptake of services by BME communities. So that's taking up a lot of our time. That's quite exciting at the moment. We're continuing obviously with the other exciting work that we do with the NHS, Together We Can Work, which is a network of members with mental health difficulties joining in to support the NHS. Other work we're involved with Chris Bridle and other members from this group is the Patient Voices Group, PVG, and that's looking at digital tools to enable people that are digitally included. And a big focus has been how do we try to encourage people to understand not everybody can be digitally included. So with lots of work. I'm not going to take up too much of your time, but good partnership work we're doing with Healthwatch and Forum Central around how do we get more people engaged with social care, partnership approach. We're doing a lot of work around weekly meetings with members to look at the Leeds social care strategy, which is exciting but very time consuming. Refresh of the 2017 to 21 adult social care Better Lives strategy. So we're looking with the Better Lives board members. I know it's a bit complicated, a bit jargony, and I apologise. I'm trying to give you a bit of an insight what we're doing. So we're trying to refresh a strategy with the Better Lives members that are made up of service users, 7 of them, and with Healthwatch, with Forum Central, Carers Leeds, and others that sit on that group. And the idea is those members are looking in detail at what comments, observations have they got around the adult and social care strategy. So we're doing a lot of stuff, and it's hard work at the moment. I've got not a lot to feedback on COVID. I did mention last time some of our efforts with Leeds Community Healthcare Trust around Woodhouse Clinic, where we've been involved in getting volunteers to help with that particular practice and to get the jab promoted in local communities. I've shared that with you previously. I hope that's helpful. Any questions, please do post them.
Yeah, that's great, Jag. And equally, I know you've been great at sharing things through the Communities of Interest email as well. So if anyone does have anything that they feel is maybe, you know, a bit too much for this meeting and they want to give any further details or expand on anything, just please share that through, and we can share it further. Damien, what's the word on the street from the Menders?
Yeah, 400,000 of them or something. Yeah, I haven't quite caught up with them all yet, but I'm doing my best. Well, I suppose we have got some actual work from the shops, actually, some word from the shops actually, because Orion's Ambassador Project works with local businesses to support their male customers, and a couple of those are reporting that the number of conversations that they've had with customers about health and stress has greatly increased since January, and that the people coming in, and this might well be women as well, because they don't just talk to the men that come in, that the anxiety levels have greatly increased. People are a lot more stressed. Not much more to add other than that, really, apart from, interestingly, the 100 tablets that Barker have managed to distribute to men. Now, this is a sort of positive thing for the future to think about, is the fact that they've required a lot less volunteer support with the tablets than was expected. So this is quite hopeful in terms of when we do manage to get these devices out to people, once you get over that initial barrier, there's every chance that they will run with that technology and be able to use it very quickly. So, you know, in some ways the barrier is just getting them engaged in it and getting it to them in the first place. So I think that's quite hopeful. And finally, just a little plug for anyone supporting Men Out in the City. We've now got a database of men's activities, which obviously might help with your all-round COVID support. So I'm going to paste that link in the chat. Okay, thank you.
And just as well, so in the last meeting session notes that we sent out, there's a link in there on Damien's section as well. So we can put it again, Damien, just so it's better to keep repeating things and sharing things and people not have them. Anne, hello.
Hiya. I will keep it quick. From Young Lives Leeds, we've had quite an interesting and quite a good meeting this morning about helping to get the messages ready for young people and the take-up of the vaccine. It was quite enlightening. There was lots of work already happening and wasn't joined up, and so we're looking at how we can bring that together and use the resources that we have. Concerns around mental health and anxiety. Anxiety now for young people going back into a classroom environment. For some, they felt quite safe at home, and obviously this is going to be a change for them. There's anxiety around exams and what's going to happen for them, and where does that lead them with job prospects and employment opportunities as well. And one of the concerning things is now the number of parents who are choosing to home educate children. It's increasing sort of rapidly. Don't know if that's just linked to COVID, but sometimes there's an assumption that when things go back to normal, they might just be able to register the child again at the same school, and that doesn't necessarily happen. So that's something that we're keeping a watching brief on, and that's it.
Thanks, Anne. And yes, I was at the meeting this morning. Great networking meeting, some really useful comments, insight, and just hear about the things that people are working on. So it will be great to kind of pull that together and share that out further with other young people's organisations and networks as well. Abby.
Hi, I'm the representative officer at Forum Central. Well, no updates with regards to the vaccine, but can I just quickly mention in terms of mental health and shielding for the Bronze, so in part of Bronze Command, we are recruiting a representative. It's a weekly meeting. And we know it's quite a commitment, but it would be good to have someone who's delivering, you know, frontline services. So if anyone would like to get involved, please do get in touch and we can have a chat about it. Thank you.
Thanks, Debbie. Anna, are you all right to go next?
Thanks, Stacey. Yeah, I'll be as quick as I can. I've got 2 or 3 things to update everybody on today. First of all, the mental health weekly check-in is now out. So huge thanks to everybody who contributed to that. I know Anne and Emily both made a really big contribution to this one. So the survey is on our website. And it echoes a lot of the things that members have brought up today, most especially couple of things. I think Emily certainly brought this up, and Anne as well. Actually, the return, you know, if in a few months' time, if all is well, we'll be sort of easing back to a more normal routine, and the real fears and concerns that many people have about that, about making that transition. You know, after nearly a year and a half of constant change and concern and worry. So that's on our website, and thank you to you all for contributing. Next, we've just released the survey for our next weekly check-in, which is on shielding people. I will pop the link in the chat in case you'd like to distribute that to your networks. We'd be really grateful to hear from anybody you think might be interested. And I will also, as ever, we're accompanying the survey with interviews with community organisations so that we get a more broader, more well-rounded picture of people's views. I'll just tell you very very quickly the kind of questions that we would like to ask community organisations. It's things like, what are your biggest concerns for shielding service users right now? What can health and care services do differently to support shielding service users? What are their worries about easing lockdown measures? What would help your service users to improve their health and fitness once lockdown's over? And are there any questions about shielding that people need answering? If anybody, if any of your organisations would like to get involved in that, I'm more than happy to give you a ring. It usually takes sort of like 20 minutes-ish to have a quick chat and gather your views about that. So please do let me know. I'd love to hear from you. And just finally, as you might know, we've been doing some work gathering people's views about vaccination since November. The People's Voices group is having a meeting tomorrow where we're hoping to bring together all the different engagement work that's been happening. So, for example, Anne, I know you mentioned you've been doing a lot of work about that this morning, and we're hoping to use tomorrow's meeting as a way of sort of gathering the intelligence and thinking about next steps. What don't we know? Where do we need to send this intelligence on to? So if anybody would like to attend that meeting, again, please do let me know. We would love to see you there. Or indeed, if you can't attend, but you'd like to send some information through, just get in touch. We'd be really grateful to hear that. But that's it. Thanks, everyone.
Thanks, Anna. That's great. Timmy Pray, hello. Where are you from? Which organisation?
I actually came from Leeds Gates, and Charlotte has already spoken on behalf of Leeds Gates. I'm a student on placement, so I'm here to observe, actually. So,
well, you're more than welcome. I think I remember seeing it you at the last meeting, but as I didn't chair it, and
yeah, I was going to share last meeting in absence of Charlotte, but you know, I didn't have the opportunity to, and Charlotte has done that today already. So
yeah, well, it's great to have you.
All right, thank you.
Sarah, have you got any update?
Yeah, I've got a few. Hi everyone, I'm the mental health development worker at Forum Central. Just to say, a lot of our organisations are gearing up to return to face-to-face care, and are really, it's a great relief to regain that access, particularly in care homes. Agree with what everybody said about anxiety. A lot of our organisations are looking at how to cope with people who are presenting to them anxious about the restrictions and how to manage that. And that's going to be an ongoing challenge, as has kind of already been discussed. Quick one about people with severe mental illness being put into priority 6. We got a couple of really good resources that we found to pass on to people in terms of communications. And I'll put my email in the chat after this. If anyone would like me to send them to them, then I can do. And like Janet said, staff uptake of the vaccine is also a challenge for our members, and something that we're continuing to work on. In terms of themes, bereavement is obviously still a huge one, continuing to find ways to memorialise people and make space for people to grieve. Staff wellbeing, managing burnout, especially with healthcare workers. And just to point out to anyone that hasn't heard, Mind is running a workplace wellbeing conference 15th to 19th of March. And it's really interesting. It'll be about how to maintain mentally healthy workplaces in an increasingly uncertain environment, and how to use learning from the pandemic to advance workplace wellbeing in the future, which I think is such an important conversation going forward in terms of what we have benefited from in digital, doing things digitally, etc. Working from home, flexible working, things like that. People financially affected by COVID, just to say, Citizens Advice have talked about an increase in disproportionately falling on young people in terms of unemployment and universal credit. Carers as well. I had a conversation with the mental health team at Carers Leeds today, just ongoing issues with accessing crisis support and the burden that puts on carers when they have to be they kind of have to pick up the pieces from that. And the Mental Health Collaborative is continuing to work on that. That's one of their priorities, access to crisis. So we're going to make sure that that message comes through loud and clear. Then people with PTSD, so that could be veterans or asylum seekers or refugees, just a call for better support for them, and the impact that the pandemic has on people who have experienced trauma, in terms of being triggering, and those, yeah, so those conversations are still happening. And then a couple more things, just to spotlight some examples of good things going on. Mathworth Theatre, I have a member from the Leeds Mental Wellbeing Service from Touchstone that comes into their sessions, and they're finding that really useful as a kind of bridge into further care around mental health. So that's been a really good model. And also Army Helping Hands have bought 4 e-bikes, and they're planning to do some trips on those when the restrictions allow. So I think, yeah, they're really excited about that, and that'll be very cool. And one more thing, Homestart are wanting to expand their board of trustees to make it more diverse. So if anyone on this call would be interested, or know anyone else that might be interested, let me know. I'll put my email in the chat now. Thanks, everyone. Thanks,
Sarah. And the winner goes to Sarah for getting the most information out. I definitely couldn't write that quick. You need to send,
absolute overload. I'll send you my notes.
Send me your notes, please. Rachel, did you want to come in?
Yeah, it was just, it might be a top tip, hopefully it will be, which is in terms of uptake of staff vaccination. So at the end of last week, we went out to our social care workforce who hadn't taken it up. And we were just really honest with them and said, look, guys, we've got really good capacity this week and next week. After that, the priority is going to have to be giving people their second vaccinations and a much bigger cohort, and you won't be there. And actually it really helped them to kind of, I think people who've maybe been a bit on the fence or were waiting to see how others reacted or how it had happened, and it just gave them that bit of impetus to say, actually, yes, it's it's a helpful thing for me to do, to book it in now rather than wait much longer. So just as leaders in your own organizations, that might be a little nudge that you can give authentically. We're also hearing from people saying, yeah, thanks very much, I don't want the vaccine and I've been offered it a number of times now. That's fine too, but just to make sure that they if they're thinking about it, they've got the option.
Yeah, thanks, Rachel. And I think it's about that, being honest with people and letting them know where we're at with things. The last thing that we want is in a couple of months' time people to say, right, I want my vaccine now, and we've moved on to a different priority group or things. Yeah. Carl, are you there? Sorry, I think you're last.
No worries at all, Stacey. Yeah, just really brief from me. So for those that don't know me, I support the development of the local care partnerships and try and ensure that the third sector has a strong voice within them. Just from the local care partnerships, they're running a series of workshops looking at COVID-19 vaccinations and inequalities. So immediately after this meeting, there's one taking place within Hatch LCP, which covers Chapeltown, Bermondsey, Hare Hills and Richmond Hill. And there's also workshops taking place in Woodley and Holt Park, East Leeds and Central. So these workshops will contain a presentation from Public Health looking at the data behind the inequalities experiences of vaccination programs, and also provide an opportunity for conversations around answering questions which might be presented around the vaccinations, dealing with any concerns. There will also be a presentation from the CCG comms team around the vaccination program. So yeah, really good opportunity to get some insight into some of the health inequalities around the vaccinations, and also get some support from the system on how to meet some of the challenges.
Thank you, Carl. So just checking, I've not missed anyone, have I? Shout out if I have, but I think we've covered everyone. So just to give you a little bit more information. So as we know, the latest, the roadmap was announced yesterday. There's quite a lot to go through on the roadmap. What we'll do is, we've been sent some information from the councillors and the MPs, which is actually a really good, easy read information. So what we'll do is we'll pull that through onto a document, and we'll upload it onto our website and send you the link, just because we're quite aware that everybody gets lots and lots of attachments, and sometimes it's nicer just to have that link. So we'll get that uploaded today and get that sent out. And just to let you know about some sort of training opportunities that's been offered by Leeds Older People Forum. So they're running a compassion fatigue training. And that's around developing emotional resilience and reducing compassion fatigue. And that's all they've sent me at the moment, and people do need to get booked on by Friday if they're interested. But again, we can share the Eventbrite for that. And then just lastly, I wanted to just cover, sorry, I've just lost the email. I've got that many things open. But yeah, so just to let you know about the Leeds Health and Wellbeing Board. So they met last week, and I think some of you did attend. It was a little bit sort of not much notice to attend. We've been given quite a bit more notice now for the next one, which is on the 9th of March. And what they're asking for is anyone from the Communities of Interest Network who would like to attend those development sessions. Some of the, thanks Cal, it is limited to just around 3 or 4 people attending each time, so we can keep track on who's attended and who's not, just to make sure that everyone kind of gets that fair opportunity to go. And again, we'll put some more details in the weekly update around who the Health and Wellbeing Board are, what their board stands for and represents, and how the third sector and the communities of interest can link in with those development sessions and be the voice of your sectors. And yeah, so I think we got through that really quickly actually today. Normally we're kind of heading out towards the o'clock time. So just an opportunity really for people to maybe say what they would want from future meetings. Are there any specific topics that people want more information on? Or is there anybody that wants to maybe have a 20-minute slot, or 5, 10, 15, 20-minute slot to come along and talk about the relevance of kind of COVID and lockdown and what's current? So it's just to say that, you know, it's not our meeting, it's, you know, it belongs to everyone, and we just want to make sure that everybody feels part of that and is able to kind of have their opportunity to speak and share information through this network. I'm not sure if anyone's got anything burning, or they're more than welcome to just drop us an email. And I just wanted to remind people as well, just quite aware that these sessions run every 2 weeks, and there might be things that, you know, you on your lunch, well, not encouraging you to work on your lunch break for 1 minute, but something might pop into your mind that we have got the share your knowledge button on our website as well, where if you've got something and you think, oh, I'll make a note of that, or I might forget, it's really quick and simple for you to be able to feed that back in as well. And just so that, quite keen to hear any pressure points within your organisation, what's working well, again, what the challenges are, and just to kind of hear that and feed that back in. Has anyone got any other business? No. So I think this was probably a first since I've started. Finish 15 minutes early, use this time, go grab a cup of tea, finish early. Don't tell your managers I said so. Yeah, great to see everyone. And thank you.
Thank you.
Bye.
Thank you. Bye-bye.
Bye, everyone.
Bye-bye. Bye-bye, Stacey.